Welcome to Conversations with Nurses, a podcast where we chat with nurses from all walks of life. I'm Paula-Holland. Join me as I take you into an inside look into the nursing profession, where we explore the human side of healthcare and gain insight into the dedication and compassion that drive nurses to care for others. So grab your headphones and come along for the ride as we dive on Conversations with Nurses. Hi, welcome back to Conversations with Nurses. This week, I'd like you to meet Jade, who's crafted a career path in critical care and a passion for providing specialised medical assistance. Jade has embarked on a journey that has taken her to new heights, quite literally, as a nurse with the Royal Flying Doctor Service. However, Jade's dedication to a profession doesn't just end there, and in addition to her aerial medical duties, she has also pursued a postgraduate diploma in midwifery, stating that this is the hardest year she's ever had to do. Welcome, Jade.
Thank you, Paula, for having me.
That's right. Jade is a Royal Flying Doctor nurse who's doing her midwifery training at the moment at Notre Dame Uni, and she's come to join us to tell us her story and how her journey came to be a Royal Flying Doctor nurse, because there's not a lot of you around, are there?
No, it's quite a niche group. I think there's about 70 of us in WA alone, so it's quite a small group of nurses.
Tell us the journey. What made you become a Royal Flying Doctor nurse? You must have been nursing well before then.
Correct. I graduated nursing from Curtin at 2008, went on and done a graduate program at a private hospital in Perth. 1 year out, I applied for a graduate ICU position, which meant a postgrad certificate in crit care whilst working in ICU.
Yep.
So that was back in 2009, 2010, and I have never left ICU since.
Do you like it?
I do love it.
ICU is one nurse to one patient, one nurse to two patients?
1 to 1, 1 to 2, 1 to 3 at a push when they're ready to step down to the ward environment.
Yeah. Quite different to ward work where you've got 1 on 7 patients.
Absolutely. You can dedicate absolutely everything to your 1 or 2 patients, whereas on the ward you might be 1 to 5, 1 to 7, 1 to 10 overnight. You'll only know this much of each patient, whereas in ICU we know the ins and outs of that patient all the way through.
Probably the whole family life and everything.
Correct. You know those most intimate details of everything that's gone on with that patient and their family as well.
Where on the ward you're just touching base with them really before they've moved on or you're moved on.
You're swimming in and out of those rooms multiple times a day, whereas ICU you're almost with that person for 12 hours.
Is it tiring doing ICU work because your brain is really switched on? You've got monitors and pumps and everything going for that patient.
Yes, it can be, particularly if you're new to that environment. It's something you need to be able to multitask. But once you've got a system in place, you're able to manage multiple infusions, a ventilator, monitoring, everything. And you've got time to work it all out. You've got time to go through it and do things properly.
Yeah.
Head to toe, A to E assessment, you've got the time. Whereas on the ward, you don't have the time to do an ATE assessment on all of your patients. It's not.
Just explain what
possible.
an ATE is.
ATE assessment. So basically head to toe. So assess your patient right through from head to toe, neurological, cardiovascular, respiratory, skin, inputs, outputs, all that sort of stuff.
Yeah.
And unfortunately in the ward environment, they don't need that level of care anyway. Whereas ICU, these people are critically unwell with lots of things happening. So it's just a nice environment to work in. It's not for everyone. 13 years later, I'm still in that environment, just slightly different in the air, this time not in the hospital. So that's how long my journey has been going for. So I finished my postgrad certificate and continued working in ICU.
In the private sector or the
In the private sector, and then I moved across to a public hospital where I was working between the two organisations. In ICU where it's hard work, but you're in one room and you might be just, around the room.
Yes.
On the ward, you might be walking up and clocking up a lot more kilometres a day than I would be clocking up. And the ward staff are busy. They do a wonderful job. They have a lot of patients, discharges, admissions, post-op patients. It's the ward environment is very, very busy. ICU is busy, but it's a different type of busyness.
Do you find that with the alarms, pump alarms, you're so tuned into them you can hear them a mile away?
Correct. Yep, I can be at the nurse's station if I'm able to leave the bedside. And I know what alarm is going off. Same with the back of an aircraft. I can hear a pump alarming, even though it's noisy. I can still hear it. I know, I do know those sounds. I dream about them. You know the different types of warning alarms, low risk alarms and critical alarms. Yeah, you definitely know the difference between them all.
I work in theatre and some days you're so tired. You've done a whole day's work and then you're on call and you're working right through till 3 a.m. and you don't even hear those alarms because you're so tired. In fact, when you drive home, you don't even remember if you drove through red lights or how you got home. So that's the life of a nurse, isn't it?
It is, yeah.
When you're switched on to those alarms, they're telling you something that's really good for you.
Yeah. And, we all do get fatigued. I would be lying if I say we didn't, because we do. You're driving home after a long night shift, you drive home and sometimes you'd think, oh, how did I get home?
I know. I've sat on the freeway and I thought, nice straight stretch. I'll just close my eyes for a minute and then keep opening it. Make sure I'm still in between the two white lines.
And that's one of the realities of nursing is shift work.
Yeah.
And nights, earlies, days, weekends, 365 days a year. But we still show up every day and we do what we do because we love it.
So have you always wanted to be a nurse, or is it something that came later in your life and thought, look at all the careers there are, what could I do?
It was something that I always wanted to do. My grandmother is a nurse, but when I left high school, it wasn't my first choice. I went into occupational health and safety and I did that for a few years.
Yeah.
Nursing was still in the back of my mind. So whilst I was working for a mining company at the time, still in the sort of health area, so to speak, I did nursing and then started doing pre-employment medicals and things like that, and then completed a grad program.
In nursing?
In nursing, correct. Back when I was 24, I think it might have been. So probably a little bit later. I wasn't direct from high school, but it was in the back of my mind that nursing was what I wanted to do, so that's why I made it happen. And then I completed the grad program and decided, I'll just apply for ICU and see what my chances are after being graduated for 1 year.
Had you done a prac in ICU?
No, okay. I hadn't. No ED or ICU pracs.
Okay.
And I interviewed and got the spot.
Good.
Along with 4 other nurses. So whilst we're doing the hospital-based training in ICU, we also completed our postgrad certificate in crit care.
That would have been a hard year.
It was. And I never looked back.
So now the story of going into the Royal Flying Doctor Service, how did you come around to deciding that's where you want to be?
I always wanted to do it, but I knew because I was not a midwife, it was probably not going to be something that I could do. At that time, a few years ago, I had 2 young children. It wasn't an option for me to go and do postgrad mid. But I sent an expression of interest into the Royal Flying Doctors just to see what was out there.
Yep.
And during COVID, so 2020, I sent my expression of interest in, and during COVID, they needed to up their workforce a little bit. So basically for COVID
patients
preparing. So 21, I got a phone call and then was interviewed, and nearly 2 years later, I'm still here. I have been fortunate enough to get a scholarship through an organisation called Rural Health West to put towards my fees. That's why I'm a third of the way through my postgrad diploma in midwifery.
And how's that going for you?
It's been tough. It is a tough course.
You're a mother of 2 children.
Correct.
And a wife.
Yes.
You're studying.
Yes.
Full-time.
Full-time.
And you're working full-time?
No, part-time now.
Part-time.
Study is a full-time job. So flying part-time.
And they've accommodated all of that because they've granted you the scholarship or given you that option to do it.
Correct. They've made it easy for me to study and still fly.
Yeah.
And then I'll graduate in June next year as a nurse midwife.
Do you have to work in Perth as a midwife? You've done the year study, but do you have to get some practical experience?
No, a good part about Notre Dame, we do over 1,000 hours of clinical practice, which is quite a lot more than a lot of the other universities that are around. So we come out graduated with quite a lot of clinical practical experience. So no, to continue working for RFDS as a flight nurse / midwife, I don't need to do a grad program.
Good.
But hopefully I'll work somewhere casually in a maternity type setting somewhere just to keep consolidating those skills. I think that would be very wise.
Yeah.
Because a lot of the pregnant women that we do transfer, not me personally, but the other staff, they can be quite unwell.
Yeah.
So the main goal is just to get them from A to B and get them there with that baby still inside.
That's right. You don't want to be delivering on a plane mid-flight and have anything go wrong.
Absolutely not. No.
So then you would like what we describe as normal births as well in a hospital somewhere where everyone's safe and normal.
Correct.
Mm-hmm.
Where there's lots of resources available to help those women.
Would your roster as a Royal Flying Doctor Nurse, how can I say that different? Royal Flying Doctor Nurse, would your roster allow you to have some shifts in Perth if you went as a casual or worked as a 2 days a week somewhere?
Yeah, there is a bit of flexibility depending on how many shifts you do per roster a fortnight anyway. Quite a few of the staff there work casually at NICU or some birth suites in different places. So there is flexibility, yeah.
Good. So that would work for other people who want some time at home and...
Correct, yeah.
Fantastic. So tell me then, with your critical care, that would have paid off really well with what you're doing with the remote nurse and retrieving people and bringing them back to Perth.
Yes.
Where would you say has that been very vital for you? Can you remember if there's an incident or a situation where your critical training just kicked in so well?
When I first started, we'd do a few weeks of buddy flights, so with another nurse, just to learn everything. My first flight out on my own, I got a call. Had been given the all clear to fly on my own.
Yeah.
I had passed everything. A call to Albany, of all places. Big area, quite a large population down there. A patient had a rather large heart attack, what we'd call a STEMI, so quite a nasty heart attack. So the nerves were there. It was doctor accompanied, nurse-doctor duo team, went down there. The patient didn't arrive, so we're waiting, and we thought, this is strange, the patient's not here. The patient unfortunately deteriorated and went into a cardiac arrest. So
Before they got to the
airstrip. So they took him back to the hospital, the St John ambulance, and by that stage, this man was intubated.
Okay.
So we had to get all our stuff off the plane and then get a taxi and go all the way into the hospital, which is what we normally do, or St John ambulance will take us when we're picking up patients. So take all our equipment and go into the hospital and get a handover. This man was incredibly, incredibly unwell, almost on his deathbed.
God.
In terms of critical care, so he was already intubated, so that was one thing done. Unfortunately, his heart was absolutely shocked. He was going, he needed to be defibrillated, then he needed to be paced, so he was very unwell, going through multiple different heart rhythms at the time, multiple infusions. Had he stayed in Albany, he would have died. He needed to get to a cath lab. So we made the decision the only thing that's going to save this man is to get him to Perth and get him to a tertiary cath lab to put a stent in his heart, which we thought we're just going to have to package him up and go.
Yeah.
So we packaged him up, got to the airstrip, and he had another cardiac arrest at the airstrip. So this was my first flight out on my own.
Yeah.
It was very stressful. And I'm short. I'm quite a short person. The pilot recognised that I was short. Our stretchers are quite high when a person's on it.
Yeah.
So he immediately pushed this stool over that's at the hangar or the transfer station so I could get on it and do effective CPR, which we did. We loaded him up into the aircraft and then he just kept arresting. We got him to Perth a few hours later, got him to the hospital, handed him over, got some stents in and was on a balloon pump for a while, 24 hours, 48 hours. He survived to tell the story. A man that was critically unwell, going through every single advanced life support scenario you could think of.
How old was he?
I think he was about 71 from memory. So that was a challenge for my first flight out. Now, when there's a resuscitation going on in the back of an aircraft or in a transfer hangar, it's just you and the doctor. There is no magic bell you can push on the wall
to get to a team. Yeah,
for someone to do this. You scribe, you give the drugs, you do this. We had to do it all between the two of us. So you have to work incredibly well together. On the way to the hospital that particular day, about 15-minute drive, we nutted out a plan. If this happens, we'll do this. You do this, I'll do this. And, if you don't plan, things will go wrong. You have to always plan ahead. Draw drugs up, even if you're not going to use them. I think my take-home message is plan, plan, plan.
Be prepared.
Be prepared, because things change in an instant. It's a confined space in the back of the aircraft. All our drugs are in a tiny little fishing box.
Yeah.
You just need to be prepared to make it work. And it worked. He survived. We got him to Perth. I survived. And we debriefed about it. What could we have done better? What we done